Everybody to tonight's coal, gas, and public health webinar tonight. And my name is Marjorie Lewis. I am a volunteer with the Sierra Club Beyond Coal team in Madison, Wisconsin. I want to thank you all for coming from all over the state. Tonight, we have a little icebreaker to get us started, and Hannah's going to tell us a little bit more about that.
Hi everyone, my name is Hannah Mortensen and I'm the Executive Director of Physicians for Social Responsibility Wisconsin and the Wisconsin Environmental Health Network. We have sent in the chat a link for you to basically drag one of the red location markers to where you are in Wisconsin. Since we didn't collect locations, we'd love to see where everyone's at. Since we're virtual, show how far across the state we can get tonight, and there's going to be a follow-up activity to this to compare to. So would love it if you could drop a pin. Again, follow the link in the chat to go to that, and you can send us a question in the chat if you're having troubles. So that's the activity.
While everyone is adding their location to the map, I want to stop and thank the following organizations for co-planning this event. The Wisconsin Health Professionals for Climate Action, Action for Climate Emergency, the Wisconsin Advocates for Public Health.
Hell with that.
Sierra Club Wisconsin's Beyond Coal campaign team, and Sierra Club Wisconsin's Equity Committee, the Wisconsin Environmental Health Network, and Physicians for Social Responsibility Wisconsin. Additionally, I want to thank the many organizations who helped spread the word about this event. If you are with one of these organizations, we would really love it if you would wave if you're on camera and drop a hello in the chat from your group. Thank you all for helping to reach Wisconsinites all over the state for tonight's important event.
Great, just going to touch base on this again before we get launched. And if you are having difficulties, go ahead and send where you're from in the chat. And we will, some of our other tech people behind the scenes here and myself will start moving those location markers for you if you are having troubles. Again, you can send that in the chat. We just want to get a sense of where everyone is and where we're all coming from. So again, that's in the chat.
So what to expect at tonight's events? Right now we're in the introductions and welcome section. Next we will be learning about Wisconsin's electric sector and kind of the lay of the land around the state. We're going to cover health and environmental justice. At one point we will be moving into breakout groups. If you could please use your mute and unmute feature thoughtfully when you're in the groups so that background noise doesn't disrupt the conversation. That would be great. We ask that you remain on mute throughout the night except during the breakout session. As we move into the lay of the land in Wisconsin related to our electric sector, we would be remiss if we did not give a lay of the physical land of our state and its history. Today, we want to honor and celebrate the indigenous people of Wisconsin and recognize the lands on which we live. The vast history of the Dakota, Ojibwe, Ho-Chunk, Menominee, and Potawatomi nations have helped shape Wisconsin to what it is today. These people were forcibly removed from their lands during the first half of the 1800s. However, Wisconsin still has a strong native presence with 12 Indian nations and tribal communities, including the Bad River Band, Potawatomi, Ho-Chunk, LeCourt Oreilles, Lac du Flambeau, Menominee, Oneida, Red Cliff, Mole Lake, St. Croix, Stockbridge, Muncie, and Brothertown nations. Across North America, indigenous resistance to fracking on tribal land is guiding the fight against fossil gas infrastructure And here in Wisconsin, Indigenous peoples are leading the fight against new fossil fuel projects in the state. Notably, with the resistance to the Line 5 pipeline from the Bad River Band and the support of Bad River's proclamation from 8 tribes, 6 Anishinaabe tribes, the Oneida and the Menominee, and the resistance to the NTEC fossil gas plant by Red Cliff due to sites of cultural significance, including burial sites near this proposed plant. We want to acknowledge the presence of these tribes and their history, as well as their continued efforts to protect and respect the environment and lands that we share with them today. If you would like to learn more about the history of the land that we are on, you can visit the website native-land.ca to see more.
Hello, everyone. My name is Gabriella, and I'm a coordinator with Wisconsin Advocates for Public Health. I wanted to start with recognizing Wisconsinites' hard work of effective organizing through coalitions, advocating, and concerned citizens taking action. These efforts have retired 4 coal plants in Wisconsin, and these 4 plants will officially all be closed by 2025. Wisconsinites' collaboration have decreased the coal use in Wisconsin from 20.4 million tons of coal in 2018 to 15.5 million tons in 2019. That is a 24% decrease in 1 year. Continuing our efforts and bringing awareness to the health issues coal plants pose helps us continue to work and helps communities make informed decisions and take action for their families, neighbors, and communities. In 2019, coal plants provided 42% of Wisconsin's electricity, which was the lowest in 2 decades. But this still means that coal plants are in Wisconsin. It's also crucial to understand that coal is not a resource found in Wisconsin and continues to be mined in Wyoming and transported to Wisconsin to the 4 remaining coal plants still operating. This coal does not bring any economic revenue for Wisconsin and is an expenditure of taxpayers' money. The oldest plant operating has been around for 65 years, which is the Manitowoc Municipal Coal Plant. And others more recently developed 11 years ago, like the Oak Creek Power Plant. These 4 coal plants vary in wattage produced, yet are all owned by large utility companies around the state, such as We Energies, WPPI, MG&E, Alliant Energy, WPS, and Dairyland Power. These utility companies are and have been making decisions for the communities near these coal plants and for Wisconsin with little regard for the health and the environmental impacts or the inequities that these plants continue to inflict on the surrounding communities. My colleague Jadine will now talk about gas around the state. Thank you.
Thanks. Hi everybody, I'm Jadine Sonada and I'm with the Sierra Club chapter in Wisconsin. I'm going to talk a little bit about gas. So as coal has been announced for retirement, we have been really excited to see a lot of generation being replaced by clean energy like solar, which you'll hear about in a minute, but we've also seen a lot of really concerning announcements from utilities who are hoping to expand their gas infrastructure. And this is concerning because despite what industry and utilities say, gas is not clean and it's not natural. And the talking points that claim that it is meant to hide the fact that gas is as much a fossil fuel as coal is. And oftentimes you'll hear talk of how gas burns clean, but methane, which is the main component of gas, can be a greenhouse gas up to 80 times more potent than carbon dioxide over a 20-year period. And it's also responsible for 30% of the climate change impacts that we see today. And in addition to methane, gas also contains pollutants that threaten the health of nearby communities, which are often those who are most marginalized, which is a really big concern. And so given the health and climate concerns, not to mention the fact that gas is not economic and there are a lot of much cheaper alternatives, it's a really big problem that utilities are proposing this new gas infrastructure across the state which you can see here in this slide. It includes a new gas plant in Superior, some gas storage tanks in Ixonia and Bluff Creek, and then there's a set of RICE units proposed by different utilities, which there's kind of like small peaker gas plants, and it stands for a reciprocal internal combustion engines. So they're much smaller than like larger power plants, but they still are gas infrastructure, and things like storage are a really, really good solution for those as an alternative. And those 2 RICE units are proposed in the Weston area and in Manitowoc. But the good news for all of this is that there are a lot of much cleaner alternatives, like I've mentioned, to all of these proposals that we are pressuring utilities to take up. And that kind of segues us pretty nicely into hearing about what clean energy is coming online in Wisconsin. So I think I'm turning it over to Hannah.
Thanks, Jadine. And as Jadine said, there's a lot of hope out there. I am sharing an image courtesy of Renew Wisconsin. Thank you, Renew, for putting this together, this graphic. So on the left side, you can actually see the gray outline of Wisconsin. The orange dots are solar, the blue is wind, and the green is battery storage. And on the left is what is currently been developed or is recently or under development or recently online. And some of the numbers are there. So this is incredible when we start to see where we are already at. So a little hope, but even more hopeful is on the right side, which is where we have potential projects that could be happening across the state. And that's where all of us have a role to play in encouraging those renewable opportunities and doing things in our own community. So part of the reason why we had you do the map activity was to get a sense of how many people were in your area compared to, you know, where these renewable pieces are. So it's very exciting to see, you know, we've got some people a little bit more there in the northern Wisconsin range to see that, you know, maybe there's more renewable opportunities that could be happening around your area. So I also dropped that graphic in that Google Doc too down below if you want to compare and see where you are relative to the proposed projects. So again, there's a lot of hope, and that's where we all can play a role. And I think I am moving on to Abby.
Hi, I'm Abby Novinska-Lois. I'm the Executive Director of the Wisconsin Health Professionals for Climate Action. And tonight I get the amazing pleasure to introduce our speakers. Our first speaker will be Dr. Claire Gervais. Claire is a family practice physician and a clinical associate professor with the University of Wisconsin Department of Family Medicine and Community Health. She is one of the founders of the Healthy Lawn Team and the Wisconsin Health Professionals for Climate Action, and she also serves on the steering committee of the Wisconsin Environmental Health Network. Our second speaker will be Michael He. He's a third-year medical student who views climate action as the greatest opportunity to improve health of his patients in both rural and urban areas. He will present his research on coal power plants and racial disparities in Wisconsin. And so without further ado, I'm going to pass it off to Dr. Claire Gervais.
Thanks, Abby, for that introduction. I'm going to be talking about, well, you see the title there, Dirty Truth About Coal and Health. And I'm starting with this infographic to just summarize basically what I'm going to be talking about tonight. So coal impacts our health at every place that it's in its production and its combustion, and then also the waste products. And as you can see there, it increases your risk for many diseases, as well as your children's and your unborn children's risk. And you can see the center, the coal combustion, what that does to climate change and global warming. And then we're going to talk about at the end what we can do. Someone else is going to speak about that more than I, but I just want to draw your attention to the QR code in the corner. If you want a sneak peek while you're watching this webinar, you can scan that and take a look at it. Go to the next slide. So looking at this first part of the infographic in more detail, there's byproducts from combustion, including air pollution and ground ozone, which are both in the air. And then coal ash, which is actually in the ground and affecting the groundwater. I'll go into more detail in my next slide, so you can move on. So as I was saying, each step of the life cycle impacts human health. We don't have to worry about mining in our state, but certainly in states that are mined, where coal is mined, you can see acid mine drainage getting into the water, and that has an effect. We're really on the other side of the river, the smokestack side. You know, we burn the coal here, and and in transportation, we're burning fossil fuels to get it here in the first place. You could see the acid rain, and you could see the coal ash pile at the end and the leaching into the water. Let's go on to the next slide. So coal combustion, this slide is meant to make you laugh a little bit, because this is all very dry, dark stuff, thus the black background. But you know, people talk about clean coal in the industry, and what they're talking about there is that kind of a greenwashing term for being able to capture the carbon at the end and get rid of it. But it's very hard to capture carbon, and it's very expensive and difficult, and very often not done most of the time. So it's kind of like saying there's dry water, no such thing. So as you can see, you know, coal combustion results in particle pollution, ground ozone, coal ash again, and climate change. Let's go on to the next slide. So what is particle pollution? Well, fine particles are kind of like a flea on a flea on a flea, as I call it. So you can see the fine particles, the 2.5 micron particles, can get into our bodies through our lungs, and then travel throughout our bodies, getting into all our organ systems, and they're very, very small, as you can see. Compare in this, you've probably seen this slide before if you've ever seen a talk on particle pollution. But it really illustrates it well. Next slide. Ground ozone is another you know, a significant issue, and this happens when sunlight comes in contact with nitrogen oxides, which are emitted by burning coal, as well as volatile organic compounds. Those two things combined make ozone, which, you know, causes a lot of respiratory problems. So anyone with asthma who has respiratory problems themselves, it actually promotes that. It can also cause people, even if you don't have heart disease or lung disease, problems there. The good news is that because of there was a lawsuit in 2013 that made the state comply with the Clean Air Act and put scrubbers on and remove the nitrogen oxide. So we're seeing less ozone in our atmosphere. This is an example from the Columbia plant showing, you know, less ozone in the air, and so better health. Next slide. So nitrogen oxide has been linked to COVID fatalities, and it's important to look at things globally because we've been plagued by COVID-19 lately. This is a study in Central Europe, and showing that, you know, long-term exposure may be one of the most contributing factors to fatality caused by COVID, interestingly. Next slide. Asthma affects kids a lot, and but it also affects adults. And we know that asthma is 3 times more likely for active kids in high ozone communities. They're very vulnerable to being affected. But it's not just children, it's really the elderly, outdoor workers, and those that are, you know, socioeconomically disadvantaged in neighborhoods that are around these areas. As I said before, the risk for heart disease is a problem even for those that haven't had it before. Ozone can contribute. Next slide. So we're going to move on to coal ash next. There's a couple different types of coal ash: the fly ash, the fine stuff, and the bottom ash. And it contains a lot of heavy metals that can leach into the groundwater and cause a lot of health effects. It's we'll go to the next slide. I think it tells us the things we need to know. There's 100 million tons of coal ash generated yearly in the US. And interestingly, most goes into unlined landfills near residential communities. Again, communities of color, low socioeconomic communities are affected most. And those coal ash dumps that were closed before 2015 are not monitored under the EPA's coal ash monitoring rule. So there's many private wells in Wisconsin that are not monitored and have become proven damage cases in Wisconsin. I've got a paper that talks more about that, but don't have time to discuss it tonight. So if you go on the WEHN webpage, you can read more about that. Next slide. Here's an example of a coal ash dump. I like maps. So you can see Portage and you can see the Wisconsin River, and then that yellow is the Columbia, the Columbia plant and the landfill there. And then there's Lake Columbia, which stays warm during the winter. So people like to fish on it, but there's a fish advisory, of course, because of mercury. There's also a lot of other heavy metals that can leach into that lake from the coal ash that's buried right next to it. And then the water that comes out of it, out of the coal plant, keeps the lake warm, and so the fish, can become contaminated and contaminate us. Go to the next slide. There's a lot of heavy metals in coal ash, but I'll point out mercury because a lot of people, are aware of that, and it can cause some lifelong changes for children and adults too, with learning, coordination, etc., and in cognitive issues for adults. Next slide. But there's plenty other heavy metals that affect people. Let's go on to climate change. So I think all of us know a bit about climate change, but you may not know that 30% of the increase in global temperature is attributed to coal combustion. So our action on this is very critical. Next slide. So there's it also has extensive public health impacts. Again, most of us may be aware of that, and I named them there, and affect Black, Indigenous, elderly, and infants more than others. Let's go to the next slide. It's actually a pollutant. CO2 is actually a pollutant under the Clean Air Act, but it's not regulated. And as I mentioned earlier, carbon capture when it comes to coal is expensive and not frequently implemented. There's really no technology that can limit the release of the CO2 as well. Next slide. So unless we address this, it's really, we'd be unable to stave off the worst health effects of global warming. And this was quoted from PSR in 2009. It's still true today. Next slide. There was an infographic slide that I just wanted to show you this, that the infographic on the previous slide will lead you to all the resources that I wasn't able to talk to tonight. So I encourage you to click on some of these resources and learn more about the health impacts of coal that I wasn't able to discuss with you tonight. Next slide. Here we are. Okay, on to Michael.
Awesome. Yeah, thank you so much for that informative presentation, Dr. Gervais. I've just got a little bit of a cold here, so I hope I'm not too muffled with my voice, but I'll try to speak as clearly as I can. So I'm just going to be adding on to this topic by discussing a bit more about the specific effects we see with coal power within the state of Wisconsin itself. So next slide, please. Yeah, so this presentation is based on a past summer research project that I've been adding on to and sort of looking to submit a manuscript for with a couple other colleagues at MCW. And this is looking at sort of respiratory function and racial health disparities in correlation with proximity to these coal-fired power plants within Wisconsin. Next slide, please. So some of the health impacts of air pollution, as Dr. Gervais just discussed, include impaired brain development in children and respiratory and cardiovascular disease that disproportionately impact specific populations. The effects of climate change are compounded with worse air quality from pollution, heat, wildfires, amongst other things. And this is one of the defining features of climate change that kind of impacts us all in a variety of ways, depending on where we live. So for example, my home province of British Columbia now prepares for and faces an annual forest fire season that frequently destroys entire towns while making it dangerous for people of all ages to set foot outside. The top left there is just a little news excerpt. The province issued a warning a few summers ago stating that each hour we spent outside was the equivalent of smoking an entire pack of cigarettes. And this photo is actually taken from just above my hometown 2 summers ago. Next slide, please. So the burning of fossil fuels is a primary source of greenhouse gas emissions, not only in Wisconsin, but around the world, as Dr. Gervais had alluded to. And these coal-fired power plants are the leading source of CO2 from electricity generation, making up about 60% of the CO2 emissions in the US, while providing about a quarter of the national electricity generation. And so this image just kind of represents the median emission values of all these different electricity production methods according to the IPCC. Next slide, please. So this data here was produced by the World Health Organization, excuse me, sort of demonstrating the deaths due to ambient air pollution. And residential proximity to these coal power plants has been associated with many of the same health impacts as seen from this study on ambient air pollution. Closure of these power plants in certain US states has already demonstrated significant local air quality improvement. So the goal of our study was to quantify the relationship between race, residential distance from these power plants, and respiratory function of Wisconsin residents. Next slide, please. So just a brief touch on the methods. We kind of examined previously collected respiratory and demographic information to evaluate respiratory function in relation to the distance to these power plants. We also looked at some socioeconomic parameters to assess for either protective or risk factors that may be contributing to these pulmonary pathologies. Spirometry measurements were taken and it gave us values of forced expiratory volume in 1 second and forced vital capacity, which was listed at an FEV1 to FVC ratio, which is just sort of a way of kind of clinically examining obstructive lung disease. So readings below 80% for us were considered abnormal, suggestive of possible declining lung function. And these participants were grouped based on the residential distance to these power plants, either further than or within 35 kilometers of the power plants. Next slide, please. So during the time this study was, all this data was collected, there were 11 coal power plants still operational in Wisconsin, and our sample included over 2,200 individuals. The odds ratio of low FEV1 to FVC value was 1.24 for those living within that 35 kilometer radius compared to those living further away, which is just kind of suggesting that there may be a higher likelihood of decreased lung function in those living close to those power plants. And then many factors were assessed as either risk or protective factors, as I mentioned, but one of the most powerful comparisons we found was that living within this radius may pose a risk of worse lung function, similar to smoking for 5 to 10 years. Although we can't claim statistical significance because the confidence interval crosses 1, it still may suggest a higher odd of obstructive pulmonary disease in those living within that radius as opposed to further away. One of the possible fallbacks of the study is difficulties accounting for wind speed and direction, as that could impact the location and the distance of sort of that particulate matter that Dr. Gervais was discussing earlier. Next slide, please. One of the other important findings we found that was statistically significant was the fact that Black individuals made up 13.3% of the population living within that 35 kilometer radius, despite only accounting for 4.8% of our total population. Similarly, Hispanic individuals accounted for 4.8% of those living in that radius, but only made up for 2.8% of the overall population. So this is just speaking to, you know, the larger proportion of people of color living within close distance to these power plants, predisposing them to the higher risk of the negative health effects of the air pollution, as we've been discussing. Next slide, please. So with these damaging effects and racial disparities in mind, it's important to look at what we can change moving forward. While it's the larger economies that tend to produce the most emissions, it's actually the poor communities and the poor nations that feel the impact first and most significantly. Building these new renewable energy sources is now actually cheaper than running current coal-fired power plants, which is greatly limiting their economic viability. So one of the strengths of our study was kind of to provide local policymakers with direct data from within the state, offering an opportunity to improve the health of our residents. Next slide, please. And again, moving forward, fossil fuel subsidies should be examined and ideally halted in favor of clean energy technologies that have dropped in cost substantially. Another thing we can look at is climate and health education should be incorporated across disciplines to inform of the tight relationship between climate change and healthcare, and particularly in the medical field. It's something that should absolutely be implemented, and it's something we've looked at MCW as well. Next slide, please. Just brief acknowledgements. I'd like to thank all the individuals listed here for all their invaluable support and mentorship over the past year, or 2 years, I guess, at this point. And importantly, I'd like to thank you all for joining us for our presentation, and I'll pass it on to the next speaker now. Thank you.
Now that our speakers have shared some of the harmful impacts of fossil fuel infrastructure, I'm going to talk a little bit about what we can do about it. One of the most important pieces of advocacy is learning to tell your story effectively. Your story will change by the audience you're telling it and how long it has to be. Oftentimes testimony has to be short. So it's good to identify which structures and elements need to be there in order to tell it fast. That's why we identify the 3 outlined below: your narrative, the problem, and the solution. For now, let's build a story based on the case for no more fossil fuel infrastructure in Wisconsin. So I'm going to ask you to grab a piece of paper. If you have one around on a desk, it can be even small, anything where you can kind of write some thoughts as we're talking about our story. If you know how to fold a paper airplane, please feel free to fold it into one, because one of the main themes is how you fold these 3 elements together. If you don't know how to fold a paper airplane, there are some instructions on the right, or you can just leave it as a basic piece of paper and just kind of split it into 3 sections for yourself. So I'm just going to give just a few seconds for you to grab a piece of paper if you don't have one. All right, I'm going to begin talking about the pieces, but if you're still finding one, it's okay. I'm just going to start catching us up on those elements. Can you go back a slide, actually? So the first is, oh, sorry, now it's on the acknowledgements. I think I just had it on my screen. Okay, so I'm going to start talking about how we frame our problem. One of the important things about telling your story is framing this big problem in a smaller way. And when we're telling our narrative, we really want to talk about the personal side. What emotions do we feel? What are our details in place and time and space? So is there a certain place that you love that is impacted? Is there a certain reason you came here tonight? What are you concerned about? What makes you feel pain? What makes you feel joy when it comes to clean energy? Think about how your community is impacted, your patients may be impacted, your ecosystem, clean air, clean water. That's going to all go into your narrative and also feed into the problem. Those 2 are really related. That's why we talk about folding the elements together. But the narrative is really where you put that emotion and your personal touch that nobody else could really speak to. So for me, I might talk about my narrative being that I have health issues. And so when it's really hot out, I tend to get more inflammation in my body. And sometimes I end up in the emergency room. So that would be the first element of my story. And then when it comes to the greater problem, I might expand that to say, heat actually impacts the entire broader community. It's related to fossil fuel infrastructure because when pollution is emitted, the atmosphere is warming, we're getting more intense heat days in Wisconsin, and that impacts the health of everybody in my community, not just me, and that's why we need to change. So that's kind of how those go hand in hand, but when I'm telling my own narrative, I might give some more detailed emotion on how I am actually impacted health-wise. When you're telling your story about the problem for a fossil fuel infrastructure project, you can also give some more facts and details about the proposal, but it's not always necessary. It depends on the space in which you're telling your story. And then lastly, the third piece of our story is always going to be a solution. Don't forget to include this. You have to leave people with either a place of hope or a place for action, especially if you're giving testimony, you're going to want to provide a specific ask. Next slide. So now I'm going to talk of just a few tricks about telling your story. So as I kind of mentioned briefly before, you want to frame a big problem in a smaller way. So climate change tends to be a big problem. It's invisible. It's slightly abstract to other people. So trying to find ways to relate this to others is important. So instead of maybe talking about how it impacts the entire globe, you might want to share how it impacts your community. Or you can frame things like climate change is harming our future into a setting that people understand. So sometimes I talk about how I felt when I walked across the stage on graduation day and how fearful I was and how I felt like I didn't really have the opportunity to pick whatever career I wanted because I knew that the world needed some big changes and that there was really only one path I could take to facilitate change. So that was my experience, but graduation day is something that a lot of people can see or imagine, and so they can feel my issue a little bit better than maybe if I said just something more abstract like my future. Doing like this sort of small, like big picture, small frame can be really important for solutions too, because it can be difficult or daunting for people to identify exactly what is needed and what steps to get us there. So providing exact asks can be incredibly helpful. This is especially important if you're talking to policymakers. And so, for example, you can feed these elements together by saying something like, please deny this proposal and provide funds for energy efficiency programs, because these programs could lower energy costs, improve health and safety, while also reducing our impact on the climate. So you provide something clear. You could even give more details on the energy efficiency program if you want. Another good trick is normalizing solutions. So this is just making it clear to other people that actions are already being taken. So you could say, you know, we already have this clean energy policy implemented in another state. Look at how well it's going. Or you could just say, look at everybody around you who is already taking action on this moment. You are not alone. You also want to avoid acronyms, complicated language whenever possible. You want your short story to be able to spread as far and wide as possible to whatever audience, even if they don't know a lot about the issue already. And use emotion. I know a lot of times people can be afraid to do that, but this is really important to not ignore. Emotions are powerful. Policymakers oftentimes have a team of analysts that have a lot of those data and factoids. So your job is really to really provide that reasoning to pursue the issue, the political coverage for them to do so. So although you might want to have as many proposal details as possible or the latest data, it's actually not always necessary. And sometimes sharing something from your heart can actually stick with people incredibly well. And then I just put a few story hooks in here as well, because I know sometimes the trickiest part for storytelling is getting started. So here's a few tricks. You can start with an interesting question, a fact or statistic that might surprise people, a metaphor or simile. A description hook is when you just paint a scene in vivid detail. So you could describe perhaps a place that was near and dear to you that is getting destroyed by climate change. And then there's the quotation hook. And so practice will definitely help your plane fly easily and tell your story more smoothly. But remember that perfect really can be the enemy of the good. I know that sounds cliche, but it's true. So just practice a few times and then hone it in the real world. It doesn't have to be a perfect story to make it count and to inspire other people. And so with that, we are going to get into our practice moment. So if you haven't had a chance to fill out your piece of paper, we're going to work on those 3 elements: our narrative, the problem, and the solution. So you're going to think what those might be for you and practice telling your story if you're comfortable. And so we're going to get breakout rooms opening.
Welcome back, everyone. I think everyone's back. We just have a couple concluding remarks. I'm wondering, Abby, if you had anything you wanted to wrap up on your section. Otherwise, we've got our conclusion from Marjorie.
No, I think I'm all good to go. Just how and where to share your story is next.
Thanks, everyone, for sharing your stories in the breakout rooms. I know in my breakout room, we had a wonderful conversation, so your story is a key tool that you can use and in your activist toolbox. As we close tonight's event, I'd like to leave you with a call to action. So please take what you learned tonight about crafting your personal stories, and within the next 2 weeks, share a story with a decision maker. There are a number of platforms that you can use to share your story. You can do this in writing. A letter to the editor would be a great way to do that. Letters to the editor are short opinion pieces that you can submit to your local paper. You could also send a letter to a decision maker like your utility company executive. And Ann Behrman with the Wisconsin Environmental Health Network created a guide for us to do this, a link to which is going to be dropped in the chat right now. You could also share your story verbally, and public hearings are a great opportunity to do this directly with the administration about climate and equity in the state. The governor is holding some listening sessions within the state in the next week on the Clean Energy Plan, and information to register is going to be put in the chat. Jadine also, it looks like, put a link in the chat about how to reach out directly to utilities. You can also share your story online. Don't underestimate the impact of sharing with friends and family on social media or through art activism or whatever kind of way that you share stories with others. Your words may have an impact on someone else's getting involved. The organizations that co-planned this event also have tools and resources to support you in taking action. There's going to be a short form posted in the chat that we ask you to fill out and let us know what method you might use to share your story. If you fill that out, someone from the coalition can get in touch with you to support you in whatever way you need to take the action that you're committing to today. I want to thank you again for attending tonight. Please continue to use your story to push for action. You can reach out to any of our organizations to get involved by filling out a form linked in the chat, and contact information for these groups, a link to the recording, and a reminder to take action, plus all of the links that were just shared in the chat will be sent to you via an email. Thank you again, and have a great night.